Myself, Dr. Karandeep Singh Syal. I am consultant intervention cardiologist in Mayo Hospital, Sector 69, Mohali. Today, on the occasion of World Heart Day, we'll be talking about healthy diet for healthy heart. On the occasion of World Heart Day, we will learn about role of diet in strengthening the heart to a healthy heart. Heart diseases are one of the most common lifestyle diseases. Some of most prominent factors for increased incidences of heart diseases includes sedentary lifestyle, stress, excessive intake of salt, junk food, smoking, excessive intake of alcohol, and smoking. Nowadays, number of safe and effective medicines are available to treat hypertension and other heart diseases. While weight control and regular exercise are critical for keeping your heart in shape, the food you eat can matter just as much. No single food can make you magically healthy, so your overall dietary pattern is more important than specific food. Now, eating more fibers and fruits in your diet can help you reduce the risk of heart disease and hypertension. Vegetables and fruits are good sources of vitamins, minerals. Vegetables and fruits are also low in calories, rich in dietary fibers. Vegetables and fruits, like other plants or plant-based foods, contain substances that may help prevent heart diseases. Eating more fruits and vegetables may help you cut back on higher calorie foods such as meat, cheese, and snack foods. Choose fresh or frozen vegetables and fruits, low sodium canned vegetables, and canned fruit packed in juice. We should be avoid it. Now have you should have a whole grain food. That is, whole grain food are good sources of fiber and other nutrients that play a role in regulating blood pressure and heart to a healthy heart. You can increase the amount of whole grains in heart healthy diet by making simple substitutions for refined grain products, or be adventuresome and try new whole grains such as brown rice or barley. Now, reducing salt can also reduce the risk of heart disease and hypertension. Eating too much salt can lead to increase in the blood pressure. Limiting salt is an important part of healthy heart. The research recommends that healthy adults have no more than a teaspoon of salt per day. Most adults ideally have no more than 1500 milligram sodium a day. In fact, the less sodium you eat, the better blood pressure control you might have. Now, reducing the amount of salt you add to food at the table or while cooking can be a good first step in reducing the risk of heart diseases and hypertension. In fact, much of salt you eat comes from canned or processed foods. Now, you should reduce the amount of spices in your food. Try fresh herbs like basil, thyme, and chives. Substitute reduced sodium versions or salt substituents. Choose your condiments and packaged food and cook food without salt ingredients. Watch on your fat intake is a third step. And now you should reduce or try to reduce the amount of fat or unhealthy fat you are taking in the food and increase the use of healthy fat in your diet. Cut out artificial trans fat as well as raising your LDL or bad cholesterol level, while can increase your risk for heart attack or stroke. Artificial trans fat also lowers your levels of HDL or good cholesterol, while can put you on increased cardiovascular risk. It's worth checking labels and avoiding anything with partially hydrogenated oil in ingredients, and even if it claims to be trans fat free. Limit saturated fat in your diet. Saturated fats are mainly found in tropical 10% of your daily calorie intake. Enjoy dairy in moderation. Vary the protein sources in your diet, opting fish, skinless chicken, eggs, or vegetable sources of proteins where you can eat more healthy fats. Eating foods rich in monosaturated and polyunsaturated fat can improve blood cholesterol levels and reduce the risk of heart diseases. Eat omega-3 fatty acids every day from fatty fish such as salmon or from flaxseed, kale, kale, spinach, or walnuts. Now, fourth step is don't replace fat with sugar or refined carbs. Our body doesn't need any added sugar, or it gets all the needs from the sugar that naturally occurs in the food. So we should avoid taking the sugary foods like carbonated drinks, breads, pasta, and processed foods like pizza, or for unrefined whole grains like whole wheat or multigrain bread, brown rice, barley, bran cereal, or oatmeal, or non-starchy vegetables. Fifth step is focus on a higher fiber food. Now, take food with a higher fiber like vegetables or other fruits which have high content, other cereals and fruits which have high content of fibers in your diet. You should eat fruits like apples, berry, citrus fruits, pears. Take cereals like barley, oatmeal, bean, nut, and different type of vegetables like cucumber or green vegetables which have high content of fiber. So lastly, the bottom line is diet plays a crucial role not only in developing but also in controlling the progression of heart disease. I advise to all the patients to adapt a healthy lifestyle which plays an important role not only in treating heart complications but also in preventing it. Thank you. Thanks a lot.